If you were to extend your digestive system into a straight line, it would measure nearly 10 meters, with the last 1.5 meters being the colon or large intestine. The cells in the lining of this organ constantly renew themselves, but sometimes the genes that regulate this process malfunction, leading to the formation of polyps, small growths, or abnormal cell clumps. While most polyps are harmless, some can become cancerous, growing and dividing rapidly until they protrude further into the colon, potentially developing into colon cancer, which is one of the most common and preventable cancers globally. The progression from a small polyp to cancer is generally slow, often taking about 10 years. The exact causes of most colon polyps and cancers are not fully understood, but it involves the activation of oncogenes in the polyp, or the loss of tumor suppressor genes that usually control cell growth. Proto-oncogenes in normal cells help them grow, but when these genes mutate or replicate excessively, they become oncogenes, causing uncontrolled cell growth. Experts believe that both environmental and genetic factors contribute to these changes. In severe cases, when polyp cells divide and spread unchecked, they can penetrate the colon lining. These cells can then travel through the lymphatic and blood vessels to other parts of the body, forming tumors elsewhere. Despite these risks, early detection and removal of polyps through regular screening can prevent many cases of colon cancer. Individuals over 50 are at a higher risk of developing colon cancer or polyps, although those with a personal or family history of these conditions, inherited genetic syndromes, or inflammatory diseases like Crohn's disease and ulcerative colitis are at even greater risk. Therefore, the recommended age to start screening varies. Consulting a healthcare provider can help determine the best time to begin. Screening methods include colonoscopy, where a long, thin, flexible tube with a video camera and light is used to examine the colon for polyps. During a colonoscopy, doctors can perform a polypectomy to remove any detected polyps and test them for cancerous cells. Other screening tests, like imaging and at-home stool tests for detecting small amounts of blood, can also be useful. In some cases, polyps may be too large to remove via colonoscopy, necessitating surgery. If cancer has spread beyond the colon, treatments such as chemotherapy may be required to halt its progression. Adopting healthy habits like maintaining a healthy weight, avoiding smoking, and staying physically active can also reduce the risk of developing colon cancer. However, the most effective prevention strategies are access to healthcare and regular screenings at critical points in life.